Hi everybody. I hope you can see me. I'm joined by the Deputy Mayor, Baroness Beverley Hughes. Thank you for being with us this afternoon. I've just chaired the second meeting of the Greater Manchester COVID Emergency Committee. We wanted to update you on that discussion and what's been going on across Greater Manchester. The truth is there's been a huge mobilisation across our 10 districts over the last week. Councils working with organisations across the public sector, private sector, community and voluntary sector, faith sector, a huge number of people involved, and we are in a much stronger position today because of all of that work. And I wanted to start by thanking everybody for what they're doing, and of course the Greater Manchester public who are helping in so many different ways. I want to take you through the main points that were raised at the meeting, and there was a big agreement around homelessness, and I'll come to that towards the end. But first, to take you through the points. Of course, everything that we are doing here is intended to support the national effort to fight coronavirus, and all our efforts are geared towards that end. We want to do everything we can to support the government, and we support the Prime Minister's message that people should stay at home. But one of the points that came through from many of our contributors this morning, and this was obviously our leaders, chief execs and others, was that there does still need to be further clarity in the government's message. It is still unclear to some people, particularly people who are self-employed, about whether or not they should be going into work, and indeed some people are under pressure from their employers to continue to go into work, and we believe this needs to be clarified. We want people to be able to stay at home, but some people are still in a position where they can't afford to follow the Prime Minister's message. We've heard this morning that the government are saying there'll be a package for self-employed people on contract, freelancers tomorrow, and we welcome that, but we hope it will be accompanied by a message at the daily briefing today that non-essential work should end right now, so that we really can go into a position where people are staying at home, giving us maximum chance of fighting this disease in the weeks that lie ahead of us. And that was a very clear message from everybody on the call. Before I bring Bev in, if I could just highlight the other two main issues that were raised, alongside another issue which is developing outside of what we discussed this morning. The first was a call for personal protective equipment. It's a call, of course, being made by many others in other parts of the country. Some evidence that it's beginning to get through to the NHS frontline, but we still hear reports that it's not reaching primary care, not reaching people on the front line in social care, and lots of concerns from our voluntary and community organisations that volunteers there can't access PPE equipment. We are doing everything we can to run our own efforts to procure more, but this remains a major issue, and it's one that we need to keep on passing back to the government to see what more can be done to speed up the release of PPE equipment, not just to NHS and social care staff. The point is being made that police staff particularly are attending COVID-related incidents and need access to that equipment. The second top order issue that came through participants on the call was the need for more testing, both within the NHS and social care system for staff, but also for staff in public services beyond the NHS. There are people who are not able to work at the moment because they have symptoms, but actually if they were able to access the test, it would free them up to get back to work. So a message that was coming through this morning is, as well, of course, prioritising the treatment of patients within hospitals with symptoms, we do need to move soon to a situation where we are testing key public service staff to therefore release their capacity back into the system if there is a negative test. The other issue I just wanted to say is kind of an issue that's fast developing, is the question of Greater Manchester residents stranded abroad. We've received a number of reports over the last 24 hours of people in a very parlous position indeed, stranded abroad with no access to accommodation or finances. This involves GM residents and UK nationals in Australia. I think that's linked to some of the decisions around the Australian border and the lack of flights incoming and outgoing, but also in Cambodia. And we're aware of a group of Wigan residents, including nurses, who are stranded in Cambodia, again in a very difficult position. They're struggling to access flights, either because there are no flights or because they've become extremely expensive. And we're making a direct appeal this afternoon to the UK Foreign and Commonwealth Office to provide immediate assistance to GM residents who are in this very dangerous position. So with that, I'm going to hand over now to the Deputy Mayor to take you through an update on policing matters. Over to you, Bev.
Thank you, Andy, and good afternoon, everybody. I'll just give you a brief update from the daily reports that are coming in from GMP to the Mayor and I and the wider partnership on the headlines, if I may, and then obviously happy to take questions later on. First of all, in terms of calls to service from the public, the 999 calls are about business as usual levels. They are being answered with an average speed of 7 seconds at the moment, so that is amazingly good, and it's thanks to all the staff who are working so hard to continue the level of service that we want to provide. The 101 non-urgent calls are at business as usual levels also. The time to take to answer those is being effective, because I'll get to this later, but in terms of the sickness absence as a result of isolation and caring, as well as normal sickness levels, is affecting that part of Greater Manchester Police the most at the moment. Nonetheless, we have seen an increased use by the public of the live chat facility, the online facility, and I'd really like to encourage more members of the public for non-urgent issues to use that medium, because it makes it much easier for us to manage. In terms of vulnerable people, child care protection and domestic abuse incidents, they are also at business as usual levels. They are being dealt with promptly. The triaging of those cases is taking place rapidly, and in fact the number of cases open for triaging is actually falling. Secondly, just to talk a little bit about the additional demand coming from the fact that the virus is here. The police are having to respond to a number of different kinds of incidents at the moment. For instance, the report today identified yesterday 64 businesses still trading that shouldn't be trading, 24 large gatherings they have had to attend to. I think we're beginning to see a rise in domestic abuse incidents, and we anticipated that this might happen in the very stressful circumstances for many families of this, and the number of hate crimes is small, but it's rising. So the demand for response to virus-related incidents, if I can put it like that, is rising, and we're seeing a daily increase across a number of categories of the kind that I've talked to you about. The resource situation generally, thirdly, for the police in relation to people affected, police officers and staff by the virus. There's a total absence figure at the moment of around 13%. About 3 to 4% of that is sickness. A very small amount of that is actual COVID sickness itself. The rest is people caring for others and having to isolate themselves. As I said before, the section of the police that deal with the incoming calls from the public is the worst affected, and we're taking measures to make sure that we can plug that gap. All the other areas of business, special operations, custody, neighbourhood policing and so on, it's beginning to feel stretched, but it's business as usual at the moment. The police are responding. However, I think everybody will appreciate that as those two challenges face the police, i.e. loss of resource through more and more of their staff being isolated or being ill, and at the same time having to stand up totally new capabilities that the police will be required to deliver to support people and get through this period. It's a challenge at both ends, and that's going to stretch the resources that the police have to respond to some kinds of incidents. And so, you know, I just say to members of the public, who are, I think, showing that they understand this already by the changes in patterns in some of the ways they're contacting the police, is that there will be some incidents going forward to which the police won't be able to give the normal response. Having said that, every incident that comes in, they will assess for the risk, for the threat, for the harm to people, and they'll respond accordingly to those and continue to respond to those where that assessment says there's a need. It's very important, though, in this situation that the public rather continue to report everything to the police. We want that to happen. If there's an issue that has affected them that they need a crime number for, they will still be able to get the crime number. They'll be able to process any loss, any of that kind through the normal channels. Finally, concerned about victims generally. You know, there will be people affected by crimes. I mentioned the domestic abuse incidents and other crimes, and we're looking in great detail at how we can make sure that we can continue the support that we always have provided for victims right across the board. In terms of current issues, the Mayor has mentioned the two that are affecting the police most at the minute. The personal protective equipment. We think that will be resolved to a point in the next 24 hours. We expect every police officer to have been issued with a kit, which will include the gloves, the mask, the sanitising wipes, and a bag to dispose of those things in when they've used them. However, for most of the officers, the surgical mask is not of the required standard, and we are waiting for those to be shipped in from abroad. The other issue is testing, and I think, as the Mayor said, you know, there may be quite a number of our officers and police staff currently having to be at home self-isolating who perhaps could come in, and the testing would enable that to happen and manage the staff resources much better. We have put calls out to people who are shortly to retire to ask them not to retire, and also to recently retired officers and staff to ask them to come back, to make sure that where we can get people to do that, we can bring those people back into service. I think that's all for now, Andy, if that's okay.
It certainly is. Thanks very much indeed, Bev. If I may then, I'll just take colleagues through the main agreement that we reached today, and that was on our response on homelessness across Greater Manchester. There has been a monumental effort going on over the last week, led by Joanne Roney, Chief Executive, Manchester City Council, Molly Bishop, the Greater Manchester Combined Authority, but organisations right across the Greater Manchester footprint in public, private and voluntary sectors to bring together a plan to support people either sleeping rough but also in shared accommodation. They have been identified as the highest risk group with regard to coronavirus infection, but also potentially then contributing to wider spread. And it's absolutely crucial from a humanitarian point of view that urgent action was taken to put in place proper support for them. So what I can tell you all today is that a package has been released today of £5 million, and that will pay for 1,000 rooms across Greater Manchester, accommodating people who are in need of support. We currently have 625 rooms allocated, and we have 375 that will be procured in the next 48 hours. These are people across, sorry for the background intrusions. We have identified 720 people or thereabouts who are currently in shared accommodation who will need our support, and 280 people sleeping rough on the streets who again will need support. And the rooms will be available for those who are symptomatic, but also others who need isolating accommodation. We are being supported in doing this by the NHS and our councils. We also have support from the Greater Manchester Homelessness Action Network, a much wider range of organisations in the voluntary sector who are going to supply personal support to people in the form of dry food products, prepared meals, sanitary and dental products, so that people are supported in the best way that we possibly can. Also, people will be issued with a mobile phone so they can contact support workers, giving that extra emotional and other support that may well be needed. So, as I say, we've identified rooms for 625 people, and more will be coming on stream. And with the release of this £5 million today, the effort can get underway now, and we hope that over the coming days, everybody will be accommodated. I would like to thank those hotels that have stepped forward to help us. The support that they've offered is greatly appreciated. I do have to say that we have had one establishment where people were accommodated, but have since been evicted, despite there having been an agreement between Manchester City Council and this particular establishment. It's Britannia Hotels, and that led to a pretty major incident yesterday where people were put out with nowhere to go. That was unfair on them, and it's unfair on the council staff who had to deal with that, what was then a very challenging situation. So while it's right for me to praise those organisations that are stepping forward and doing the right thing, equally, I think it is important to say that we don't accept that kind of response once an agreement had been reached to accommodate people, and we consider that to be an extremely disappointing approach from that particular organisation. And it's only right that that is, in my view, brought to public attention, because we won't and don't think, we won't accept that in this situation. We don't think it is the way that things should be done. But overall, it's a positive story of everybody rallying round. And the point I would want to stress is that Greater Manchester has done this itself. The money we've released today is money that we held in a fund for a separate purpose, but the 10 leaders and myself have agreed to release that funding to pay for this support. It is very much a Greater Manchester effort, doing what we can ourselves to respond in the best possible way. And because of the funding we've released, we can say that we will be able to house all people in Greater Manchester who are sleeping rough or in shared accommodation, in shelter accommodation, and they can move soon to single room provision, which we think is the right response to the situation that we find ourselves in. So I wanted to share that piece of positive news with you. I want to thank all of those hotels who are helping us with this major effort, and indeed all the council staff, those in our faith organisations, the voluntary sector, who've rallied round to make this possible. So I'm going to finish there and just say that there is a huge amount of work going on. We do ask businesses who are still open, who are not involved in essential work, really to listen to the Prime Minister's message and to let people stay at home and not be in work unless it's absolutely essential. You know, this is now a moment where we are about to face a real test. Nothing that anybody is doing now should be unnecessarily contributing to the spread of this disease. It couldn't be clearer. If your business is still open and you are not involved in essential work, you need to close it now. And I ask that through all of you on this this video call, we get that message over, as well as making the appeal to business organisations that if they are in possession of any personal protective equipment, that they make it available to us by negotiation, but if they could come forward and make it available, because there are staff in the health and care system, in the police, in the fire service, in the voluntary sector who desperately need to access that equipment as soon as possible. So if I could put that call out for any help with personal protective equipment, that would be hugely appreciated. So Ross, I know you're moderating. I will finish there, but if we could begin to have people's questions coming through, I will take them one by one, and obviously invite the Deputy Mayor if she needs to reply.
Yeah, I'll take you off. So we have, if you look at the Q&A, the first question there is from Hannah Miller via email, and it concerns the construction of warehouse sites in GM. Can you see that one?
Yeah, I've got that, Ross. So shall I pick that up?
Yes.
Have we had any communication? Not myself directly. I've had people individually, more workers getting in touch with me. A huge number of workers over the last 48 hours. People who are self-employed, people who work for construction companies, in a whole range of work that you could not describe, in my view, as essential. And in many ways, the complaint has been that they've been required to go into work. So I've not been able to talk to all of the owners of those companies. I would, though, ask them to look at the lead of organisations like Taylor Wimpey, where they have taken their own decision to close all construction sites. That is exactly what should be done. Somebody contacted me last night, somebody who works on a building site, saying that they've no choice but to go back home to the house that they share with an elderly parent who's in poor health. And if people think about that, then I think they will hopefully come to the conclusion that they should be not be asking anybody in that position to go into work. And hopefully that message is beginning to get through. But I do call again on the government to make it much clearer at today's press briefing. Second one of Hannah's questions was cash flow for councils. That is an urgent issue, and I have to say there is still a lack of funding coming directly through to councils, given the pressure that there is upon them. There is some release of funding, but there is also a kind of an in principle suggestion that if costs are incurred, then they will be met by the government. So we've had some support from the government, but the point is we're going to need much more if we're to rise to the scale of this crisis. And the homelessness package I outlined is an example. That's a Greater Manchester decision to release that funding. We haven't got a guarantee at the moment that the government will provide that, but nevertheless, we've gone ahead this morning and made that available. The final question is, have I been involved in plans or the proposal to turn Manchester Central into a temporary hospital? Is it a move I support? There is an effort underway, led nationally, particularly with military involvement, to identify locations across the country that could provide wide-scale hospital capacity, or indeed, I'm afraid to say, mortuary facilities. Of course, Greater Manchester is a location that they are looking at, and we are aware of that. I don't think any final decisions have been taken about precise locations, but obviously the one that's been mentioned is one I'm sure that would be a possible location, but there are others in Greater Manchester that will be looked at as well, and we'll update colleagues about that in due course.
Okay, we've got Alistair from Radio 5 Live. There's a question for Bev. So for Bev, you can see the question from
yes.
Domestic abuse calls.
Yes, I can see Alistair's question. Thank you. I'm sorry, Alistair, if I wasn't clear enough. What I was saying was that at the moment, the overall level of domestic abuse open cases that are coming in are at the kind of levels that we would normally get. But within that, because the police now are classifying any incident that they think has arisen with some connection to the coronavirus situation, they're flagging it as a situation arising out of the current position, and there's a small number of those within the daily totals. And so that is just something of concern. The second question that you've asked is, why would we anticipate those cases might increase? Well, I don't think you don't need much of an imagination really to think about that. We're entreating people to stay at home, all their children are at home. Many of those people will either have significantly less money than they had before. Some may not have any money at all yet, unless the self-employed package comes along pretty quickly. Those would have been probably low-paid people anyway. So the tension to arise in the home, in the domestic situation, as a result of what we're asking people to cope with in order to suppress the virus, are going to increase those tensions, and therefore we would, be right to think about this might display itself in an increase in the number of domestic incidents that we're called to. We are preparing for that. Some of those most serious incidents will be challenging to deal with, particularly if the victim needs to be moved to a refuge. Clearly, that's a challenge in the current circumstances. But the police who specialise in these kinds of cases, and the local partners, the local authorities, who are really strong partners in terms of our response to domestic abuse situations, they're working together really closely to prepare for that. And in particular, as I said in my introductory remarks, thinking about how we support victims in those situations. So that planning is going on now.
One more for you from Jennifer Williams at the Manchester Evening News. They can see about the call-outs to business.
Thanks, Jen. Hi, hope you're okay. I've got no information on the daily return as to what those businesses were, but in our conversation this morning at the committee meeting, we heard from the police around some of those. Some were pubs and some were retail outlets. And the police have now, they're talking to us this morning about what their response to that will be. So in relation to any pubs or social outlets that are still open, they will be visiting those premises together with licensing staff from the local authority, having that conversation and insisting on closure. So they'll be dealing with all of those incidents on a case-by-case basis as we go forward. But we really hope that if we can be, stronger, and the government can be stronger in the messaging, that the number of businesses that are trading still start to diminish, and that won't be necessary, because it is a call on police time and local authorities time that they could well do without at the moment.
Thank you. I think you picked up a few of these points, but there's a question from Joseph at Bolton News and Berry Times. It talks about mounted police and the pressures on the police. I don't know if there's anything either Andy or Bev wanted to add on that point.
Is this from Joseph? Joseph Tiemann?
Yes.
Yep. We had a discussion about this morning. I think what the Chief Constable and what I will say and the Mayor will say is that we really need the public's cooperation here. Clearly, if the police have to put a lot of resource into trying to get people to stay at home, then that is resource that they can't use elsewhere. But as we said this morning, and the Chief Constable was very strong on this, we've got a strong and very important tradition of policing by consent in this country. We get cooperation all the time from the vast majority of the members of the public, and we think that will continue. I just think the messaging needs to be stronger, and therefore, if it is, the number of incidents that the police are required to respond to with people who are out and about will get less and less.
Okay, we have another question, one who's not asked it already. Kevin is back from Radio Manchester at 2:49. That question came in, and it's about construction sites and the issue of penalties that contractors will face. Andy, I don't know if you want to pick that up.
Thanks, Ross, and Kevin. Thanks for your question. This is, I think, the problem, Kevin, with where we are. As I understand it, this whole issue was debated at Cobra. Sadiq Khan, Nicola Sturgeon, Mark Drakeford all said there had to be a clear decision about the closure of non-essential construction sites, and that would mean the vast majority. It would only be those involved in building hospitals or other such capacity that should be allowed to stay open, and it wasn't agreed. And the fear is that there's an economic concern here being put before a health concern. Now, I understand the need to minimise damage to the economy, of course, and everybody wants to ensure that so that the recovery isn't as long as it might otherwise be. But in the middle of a global pandemic, I think I'm clear, as is Sadiq and others, that health reasons are the only reasons really that should guide decision making at this particular moment in time. So even if there are contractual issues around projects not finishing on time, those are issues for the industry and the government to resolve afterwards. The issue here is nobody should be sent into work, in my view, which then might put them at risk, or indeed their family at risk when they come home, or indeed travellers on public transport if they are in the same carriage. I mean, this is the point. The more that we allow this to happen, the more that the virus will be spreading. And it's, in my view, probably spread more than we would have wanted today and yesterday. If the decision had been clear on Monday night that it was stay at home and that applied to everybody, with the exception of those essential workers as defined, then I think we'd be in a stronger position and a clearer position. Now, I understand how difficult it is for the government. I'm not saying it's easy. I get the things that they're trying to balance, and this isn't about making life difficult for them or anything like that. I just think clarity is at a premium right now. And I think this package for people who are self-employed also is important, because we need people to be able to follow the government's advice to stay at home without facing severe financial hardship. So that's, I think, where we are at the moment. I think there needs to be a clear government decision that non-essential building work has to stop, and the contractual consequences of that decision need to be picked up later. Health is the overriding concern now, and that must come first.
Thank you, Andy. I think we'll get time for just a couple more questions. I think it might be worth taking two questions. And if you look for Ian Hills at Withenshaw FM asking about car parking for NHS workers.
Ross, could I take Kevin's second question on homelessness, just to say a little more about that, because I think it is really important, just to re-emphasise, Kevin, that this isn't just giving people a room and that's it, walking away. A huge amount of effort has gone on, as I said, engaging the members of the Greater Manchester Homelessness Action Network to create welfare packages for people, both in terms of food support, sanitary products and personal hygiene products. Restaurants are involved in this, making sure that people have prepared meals. And as I said, I'd like to thank the hotels that have cooperated with it. People will be given a phone, so they have that wider contact, because I'm sure, like everybody, we've all got concerns now, and social isolation is actually an issue that the leaders this morning on the committee call were all felt would become a growing issue in the weeks ahead. People feeling isolated and anxious in their homes or wherever they happen to be. So it is very much a wider welfare package around the provision of a single room, and as I say, it's been an heroic effort by many hundreds of people across Greater Manchester to stand this up so quickly. But the leaders have signed this up, rubber stamped it today. We've pressed the button. This money is being released. These rooms are being opened, and I would just like to thank everybody here for what they're doing to make it happen. We can have people in rooms tonight and even more tomorrow. And I think just worth saying, I want a legacy to come from this as well. In some ways it shouldn't take this moment to be able to work in this way, but sometimes it does. But having released this funding, we want to ensure that this does help us with our ambition of ending homelessness, rough sleeping across Greater Manchester, because by getting people in, it won't be the case that we'll just then put them back on the street once this is all over. I hope this can be a permanent route away from the streets for many of the people who will benefit from this scheme.
Thanks, Eric. I think we wrap up now. We'll just take one round of 3 questions if that's okay. We'll get Ian Hills from Withenshaw FM asking about car parking for NHS workers at 250. Niall from the MEN asking about, do we have a number of people stranded abroad And I think the final question is Jennifer Williams at the Manchester Evening News asking at 2:49 if we're roughly 2 weeks behind London, are we sufficiently prepared for a similar outbreak?
Okay, thanks, Ross. So Ian, your question around free car parking for all NHS workers, it's something that I would very strongly support at this particular moment in time. I understand that NCP are making some free car parking space available, and that's very much appreciated. But I would certainly support the calls on the NHS to make car parking space free. That's because it's the safest way for NHS staff to travel. It's a slightly contradictory message to the one we would normally give out, but at this particular moment of time, I think for them to travel on their own in a car is obviously a much safer way for them to travel, either in terms of picking up the infection from somebody else on public transport or giving it out. So I would say that this is actually very much justified on public health grounds. And I would emphasise the call on the NHS and the Health Secretary to see if we can put in place this parking capacity as soon as possible, because obviously we should be giving an incentive to staff to do the right thing. And I think right now the right thing is to give them that ability to travel in isolation, which I think would support the wider effort. In terms of Niall's question, the number of GM residents stranded abroad, I don't have a ballpark figure at the moment. I can only judge by what I've had in terms of approaches over the last 24 hours, and I think it's in the tens at least. There's certainly a good number of people that have made themselves known to me, and that I would guess is probably the tip of the iceberg. It does seem to affect people particularly in Asia, Cambodia and Australia I mentioned, but it would appear to be restrictions on flights between Asia and Europe is causing the problem. So we are in urgent discussions this afternoon with the Foreign and Commonwealth Office, and we will update you as and when. But my worry is the people in this position are in a very, very vulnerable position, and we need to get a solution for them. Some of them have run out of money, got nowhere to go. This needs to be addressed very, very, very quickly indeed. And Jennifer, your question 249, if we are 2 weeks behind London in terms of cases, are we prepared on that timescale to deal with a similar outbreak? I think it is generally accepted that we are about 10 days, 2 weeks behind London. We've seen an increase in cases over the last couple of days. Obviously, work is underway to discharge from hospital those who could be discharged, and so our hospital capacity has dropped a little in the last week, but that's obviously in readiness of what is to come. So, I'm very confident in the colleagues who are working to plan the capacity needs across the system, and we will have to obviously keep a very, very close eye on this day by day. But I am confident that the Greater Manchester NHS is as prepared as it could be, but it's why I come back to the point about not making things more challenging than we should do, and that is to reiterate this point about non-essential work ceasing right now, because we should not be creating new cases of coronavirus when there is really no justification for that happening. So I'm very much in support with the position taken by the Mayor of London. I feel exactly the same as he does, but of course we are looking at every possible contingency, and the efforts going on nationally to source extra capacity is something that we support and we will fully cooperate with. So it's a big challenge for everybody, and we are doing everything that we can, but it's why there is this need to make testing capacity available to NHS staff, because it's not just a question of beds and buildings. This is about people, and there are people who've had to go off work who probably now are not symptomatic and therefore could come back to work if the test could be done. So the call is on the government not just to release testing capacity to test patients. I think they need to move into a phase now where we have testing capacity made available for public servants and particularly NHS staff, alongside the PPE equipment, which is still causing considerable concern. So it's hard to say at this point in time that everything is sorted and it's all fine, because obviously this is a fast-moving situation. But what I can say is we are doing everything we possibly can to put us in the best possible position to deal with what lies ahead in the next few days and weeks. Okay, everybody, can I thank you for joining this call, slightly unusual press conference for the Greater Manchester Combined Authority, but obviously thank the Deputy Mayor for taking part as well. I hope we've been able to answer some of your questions. There was a lot of agreement on the call today about the issues that need to be addressed, but also just how magnificently the city region is responding, businesses stepping forward and doing so many good things, the 2 football clubs donating to our food banks. It's often at times like this you see the best of people, and we always do see that here in Greater Manchester. So want to through you thank everybody for everything that's being done, but you will hear more next week about our plans to support vulnerable people in our communities, more to support volunteering, because we've got work underway on that, and we'll update you on all of that in due course. And sorry for the interruptions behind me with the BBC style incident, but yeah, we're all getting used to working at home, and it presents quite a few challenges, but I'm sure you're finding that as well. But stay well, everybody. Thanks for all your support. I think we all need to pull together, and I'm absolutely confident that that's what Greater Manchester does best, and we'll get through this. Thank you, everybody.
Thank you. Bye.